Hello, my name is Vana. I'm a registered nurse, and this message is for Federal Health Minister Patty Hajdu. I just want to say thank you so much for taking the time to listen to those of us who are advocating for legal therapeutic psilocybin use. Um, Psilocybin therapy is safe, effective, and a reasonable treatment option for a variety of health conditions from treatment resistant depression, PTSD, substance use disorder, and all the way to end of life care. Over the last little bit, we did see a rise in mental health crisis, especially during the pandemic. We saw a rise in deaths associated with substance use disorder, and there are many patients that have died, and many end of life care patients that have died in the process of awaiting Section 56 exemption. Um, and a lot of these conditions could have been either prevented or they could have been dealt with in a more timely manner. However, the systems that we have in place are neither effective or efficient at tackling these issues. The process of being granted the Section 56 exemption is simply, it's just unsustainable. It lacks empathy and it can be viewed as discriminatory. It's unsustainable in the fact that it's time consuming and there are multiple players involved, and the process of from applying to being granted the exemption is very arbitrary. There's no real timeline. There's no knowing of when things will get moved along. It's the process lacks empathy because it can be triggering for patients. Because the patients that are applying for the Section 56 exemption are already in a very vulnerable state. They're in probably the most vulnerable position of their lives. And the process is actually adding to their suffering. And that's just not really acceptable. It's discriminatory because it places suffering in different categories. And it's like saying certain types of suffering are more worthy than others. And suffering unfortunately exists outside of palliative and end of life realms. And going back to the earlier point, we have seen many overdoses and many mental health crises steadily increasing over the years. And people who need this therapy deserve to have equal access to safe and effective psilocybin therapy. With the rise in demands for alternative treatments, once again, pointing back to the same issues that I pointed out earlier, we need healthcare professionals that are trained, and part of the training requires experiential learning, and exemptions haven't been granted for training purposes anymore, and that becomes problematic. We don't have the current supply to meet the demands that are steadily increasing. And with the potential of psilocybin therapy or psychedelic therapy being legalized in the future, it is very beneficial to have trained professionals waiting so that when the floodgates get opened, hopefully, we're all ready to be able to provide the support that we need to. At this point in time, even the patients who are approved the exemptions have to buy their psilocybin mushrooms from the unregulated market. And this puts them at risks that they really shouldn't be in, and that could be mitigated. We're in desperate need of change to our drug regulations that would create safe and accessibility to psilocybin through legal prescription. And the decision to actually initiate the treatment should be between the patient and their healthcare providers. So whether it's their healthcare team, whether it's their doctor, these are people that know the patient on an intimate level, on therapeutically intimate level, and they will have a better idea of the treatment plans and the treatment options that this patient would benefit from. Not an administrator who sees the patient on a piece of paper and then makes a decision based on whatever it is that they make the decision on. They don't know the patient. They haven't worked with the patient. They don't know the patient's psychological history or health history. So that should lay within the healthcare team. As I said earlier, it's great that we're having this conversation, and I'm grateful that you're even listening, you're willing to listen. But this is time sensitive, and I'm hopeful that we will progress towards creating a system that is capable of supporting our patients. I thank you once again for taking the time to listen, and I'm really hopeful that we will be moving in the right direction and be able to support our patients and our citizens. Thank you.